Hello, my name is Dr. Pakalote. I'm an obstetrician gynecologist specialist, and I want to talk about a very important health challenge that a lot of women face, known as polycystic ovarian syndrome. This video is made for every woman to be able to watch. I'm going to break it down so that everybody can understand. I'm not going to be technical as much as possible. All right, and the problem is I see a lot of women with this condition, and for years they didn't know there was anything wrong with them, and they only come to the clinic, to the consulting room, because they are not getting pregnant or their menses is very irregular. And taking their history, realize that this has been progressive, most often since their teenage years, and they never knew they had a problem. All right, so share this video, share it to all your female friends, subscribe. I'll be making more videos so that you can get notified as soon as it happens. So basically, what is polycystic ovarian syndrome? Whenever we say a syndrome, it means it's made up of a number of things coming together to give you that disease. All right, and it's something that affects about 5 to 10% of women. That means it's very common among women. Okay, so for a woman to be diagnosed of having polycystic ovarian syndrome, she normally has to satisfy 2 of 3 medical criteria. But before I go into that, another thing to note is that most women with polycystic ovarian syndrome are obese. All right, so obesity really plays a very important role. But not every woman who is obese has polycystic ovarian syndrome. All right, and not everyone who has polycystic ovarian syndrome has obesity, but obesity plays an important role. And in the management, when we come to that, you would realize that most women are advised to lose weight, which helps improve symptoms. So what are the 3 criteria that a woman has to satisfy? As I said, at least 2 of them to be diagnosed of this syndrome. One is what we call irregular menses, all right? And that is what makes a lot of women present to the clinic. Their menses is irregular. So you see a lady, she hasn't had her menses for 2 months, 3 months, sometimes 6 months. Some will even tell you for a whole year, all right? Others have what we call oligomenorrhea. That means their cycle length is long, more than 35 days. So basically, if you're having your menses less than 10 times in a year, it is a cause to worry, and you definitely would need to see a gynecologist. So that's the first criteria. The second criteria is hyperandrogenism. And when we say that, we mean the lady has high level of the male sex hormone known as testosterone, all right? And this gives them a lot of symptoms which they have, notably what we call hirsutism. So you see a lady and you realize that you have hair on your upper lip, which we call mustache, you have hair on your chin, you have hair on your chest, on your abdomen, or your inner thighs, mainly in the midline, all right? That indicates high level of the male sex hormone, and that is also a reason, and I'll come to the reason why that happens. And the third criteria is we do an ultrasound scan to look at your ovary. And most people with polycystic ovarian syndrome, they may have a lot of cysts around the edges of the ovaries, all right? That we see when we do an ultrasound. But as I said, you don't need to have all these 3 conditions to be diagnosed with polycystic ovarian syndrome. Some may just have 2, and that is enough. Now, what causes polycystic ovarian syndrome? That's a question I get a lot from a lot of ladies. It's poorly understood, the etiology, but of course there's a genetic factor, and sometimes you realize that it runs in families, all right? And there are 2 hormones which are also really associated with it. Abnormalities in those 2 hormones leads to a lot of the problems and the symptoms that the lady has. And one is high level of a hormone called LH, or luteinizing hormone, okay, which is secreted in the pituitary gland. Luteinizing hormone stimulates the cells in the ovary, which are known as the thicker cells, to produce a lot of androgens, all right, which is the male hormone testosterone. So this is what causes all the problem with the hirsutism, as I said earlier, on the hair on the upper lip, the chin, the abdomen, and the chest, okay, due to the high level of the luteinizing hormone. The other hormone is insulin. Insulin is produced in the pancreas, which is supposed to help bring glucose down, all right? And most people with polycystic ovarian syndrome have what we know as insulin resistance. So they secrete a high level of insulin. Their body doesn't really respond to the insulin, and so they may have a high glucose level in their blood, which is what we know as diabetes. But in this problem, the insulin, high level of insulin also causes the thicker cells in the ovary to produce a lot of testosterone, and this is all what causes the hormonal imbalances that they have in the polycystic ovarian syndrome. Now, what are the health implications or the risk that a person with polycystic ovarian syndrome has? Number one, they are at risk of diabetes, from what I have already said, because of the high level of glucose in their body. Okay. Number two, they are at risk of heart diseases like hypertension. We have something called metabolic syndrome because they have high levels of lipids and glucose in their body, so they are at risk of hypertension. They are also at risk of infertility, and that's what brings them to the hospital, because you are not ovulating, you do not produce eggs to be fertilized, because ladies with polycystic ovarian syndrome normally do not ovulate, and that is why they do not have their menses, all right? Yeah, you are at risk of endometrial cancer, or what we call endometrial hyperplasia, because you are not having your menses. There's unopposed estrogen secretion. Your endometrial lining is always growing, you're not having your menses for months, and that can lead to cancer. So it's very important that you have your menses every month, and we'll talk about when it comes to treatment. Of course, you're at risk of obesity due to the insulin resistance as well, and obesity plays a very important role, and losing weight helps a lot. Now, when it comes to treatment mainly involves managing the symptoms that the lady has, all right? So we tend to manage them. Now, one of the symptoms is not having your menses. So there are drugs that we give to help manage your menses. Some are contraceptive pills that we help to help regulate your hormones because you're having hormonal imbalance. And a gynecologist has a way of doing it to help you have your menses. There are drugs we give you to make you bleed every month, which is very, very important so that you don't end up with endometrial hyperplasia or endometrial cancer, all right? With the problem of the high testosterone and the hairs on the chin, male hair distribution, there are also drugs that we give you called anti-androgens, which helps stop that and help manage that as much as possible, all right? We also encourage you to lose weight, very important, because weight loss alone reduces the symptoms significantly, all right? So we encourage you to lose weight. Now, of course, the biggest issue is the problem of fertility. Most ladies with this problem come to the gynecologist because they are not getting pregnant. They've been trying for years, they're not getting pregnant. Obviously, they will not be able to get pregnant because they are not ovulating. It means their ovaries are not releasing an egg every month, and that is why they are not having menses, all right? Of course, if you have this issue, you don't need to worry. There are drugs that the gynecologist will give you to help stimulate your ovaries to release egg every month, all right? There are various drugs that we use. There's also an option of IVF as well, especially if you are aging and you're not getting results in terms of getting pregnancy, all right? So having polycystic ovarian syndrome doesn't mean you can't have a child. A lot of ladies who have it are happy they've been able to have a child. Okay, so this is all I have to say about this very important topic. I hope I've been able to break it down to you. All right, watch it, understand it, drop your comments in the comment section. Feel free to ask any question. My contact is also available. You can always reach me. And subscribe. I'll be sharing more videos like this in the future so that you can learn more about your sexual and reproductive health as a lady. Thank you very much.